Hello, my name is Vanessa Nino, and I'm the Manager for Language Services at MedStar Georgetown University Hospital. And I will be speaking to you today about interpreting VRI in the medical setting. There are a lot of information that I'll be sharing with you, and I am going to be talking about sign language interpreter as well as spoken language interpreter. I myself am a Spanish interpreter, so I want to make sure that you understand that. Furthermost, I've worked for many years, for 11 years, with sign language interpreters, and most what I've learned from them when it comes to sign language. So it's very important for you to know that part of what we're going to learn is understand who the Joint Commission is, which is the accreditation agency for hospitals, and what the regulations are when it comes to the medical setting. If you are going to be interpreting via VRI in a medical setting, you need to understand what the expectations are. I want to make sure that you become familiar with the requirements of the Joint Commission, and I also want to make sure that you're prepared to interpret in a medical setting. So, let's talk about the new hospital requirements for patient-centered communication. These new hospital requirements are stated by the Joint Commission, and they're set to begin July 1st of 2012. So, Joint Commission is an independent, non-for-profit organization which accredits and certifies more than 19,000 healthcare organizations and programs in the United States. Their accreditation and certification is recognized nationwide as a symbol of quality that reflects an organization's commitment to meeting certain performance standards. So, the new Joint Commission standards, as I said, they will begin July 1st of the year 2012, which is soon, later on this year. They want to make sure that healthcare is understood as being dependent on communication with the patient and the provider. Anything that is communicated between patient and provider needs to be understood by both parties. And that's where us, the interpreters, come to play. Communication has been identified as a root cause for sentinel events reported to the Joint Commission. Now, a sentinel event is not an event in which somebody has died, lost a limb, or been very ill because of it. A sentinel event can be a moment in which something major could have happened or something major did happen. So both of those are designated as sentinel events. So everything that the Joint Commission is doing is step by step on everything that you're doing in the hospital. First part is the admission. And as you can see in the PowerPoint, I have highlighted certain areas that are directly related with communication. We want to identify the patient's preferred language for discussing healthcare. Again, that's what they're there for. That's what they need to communicate to the provider. So the provider and the patient need to understand and make that very clear. So identifying the language that the patient is speaking in is going to be important. We also want to make sure that we identify if there are sensory or communication needs. Some of you are CDIs, and a CDI would be using sensory skills. So they would be using the sensory skill together with the sign language interpreter to provide that information to the provider. Also, we want to identify if the patient is using any assisted devices. If the patient, for example, is hard of hearing, they may need the assistance of cart services, or they may need somebody who they can read lips or use English as an assisted device. In the assessment of the healthcare, they want to again identify and address the communication needs that were assessed during the first part of the admission. We want to make sure that that is communicated to the next step in the hospital stay. We also want to identify the patient's cultural, religions, or cultural beliefs and practices that may influence their care. When it comes to interpreting services, many times we have to act as cultural brokers, in which we're explaining to the provider a little bit more about the reason why that patient may be here. As a spoken language interpreter that's coming from a different country, I may be very familiar with practices that are common in the country I come from. Or an interpreter for spoken language, again, that may be a Muslim, may be able to give some insights about their religion to the provider. So as sign language interpreters as well, you may learn or know something about a culture that the patient may be from, especially if this patient is from a foreign country and you recognize, given their sign language, that they're not speaking American Sign Language. In the treatment, we want to make sure that we're addressing the patient's communication needs during the treatment. The fact that the patient may be intubated, the fact that the patient may have sedation, we want to make sure that during the whole course of care for the patient, we're assessing their communication needs and what they need or what they will benefit with in the communication with our patients. So we want to monitor mental changes, mental status changes, or communication changes from our patients. We want to accommodate, again, patient cultures, religious, spiritual beliefs and practices. This way, as they go through their treatment and care, if something happens and they may need the assistance of a religious person or a religious view from their group, we're able to provide that. End-of-life care is probably the hardest part that we would do for interpreting for our patients. End-of-life care, even though we may be from a certain culture, even though we may have a certain background, it's different for each one of us. Most of the end-of-life care may be specific to a family, not necessarily to a culture. So we want to assess the communication needs and what they may need with it. We want to monitor the changes in the patient communication status in this end-of-life care. We also want to make sure that we are involving our patient's surrogate or the decision maker in the decisions that are made during this end of life. For discharge and transfer, the patient will be going home or the patient will be going to a different facility. So we want to make sure that we have communicated with our patients all the information that they may need for that transfer or that discharge. The patient may need the assistance of a family member who would be caring for them during this time when they go home. That person needs to understand what's going on. In many cases, the patient may not need the assistance of an interpreter, however, the family member may. Hospitals want to make sure that this information is communicated through them. So, all this information, how does this pertain to VRI? Obviously, the patient has to go through a whole process during the hospital stay in which they're communicating consistently with the providers, with the nurses, with everybody who's giving them care. So if you're called to interpret, or if you are on monitor to interpret, we want to make sure that you understand what those communications means are. As an interpreter, many times you're the one who's first going to understand what the needs of the patient are. Whether that need may be for a different kind of interpreter, for if that may mean having an interpreter present rather than over the video. It is your responsibility as an interpreter to let that provider know what the patient may need. Also, the family may be asking for that. The patient may be asking for it. Assess the patient, assess for understanding of the patient and family so that you're providing the best care for them. There are Joint Commission requirements that are very specific to what the interpreters are going to be doing. At this time, with the changes, the interpreters are being looked at not just in person, but over the video for having full certification. The Joint Commission is looking for interpreters that truly understand and know what it is to interpret in critical situations. We've already described the hospital course, and based on that hospital course, we want to make sure that the interpreter understands step by step where the communication needs may be. The Joint Commission requirements also give the patient the right to receive information in a manner that he or she understands. As I said earlier, if the patient is sedated, or if the patient is nervous, or if the patient's mental status has changed, we want to make sure that they know that I'm going to sneeze. Sorry. I apologize for that. Thank you, sorry. So we want to make sure that the hospital respects every step of the way what the patient is needing. And you, the interpreter, is going to be the person to be able to provide that service and help them understand what it is that they need. So VR interpreters that are not certified may be unable to do medical interpretation. Most hospitals around the country are updating their policies regarding interpreting qualification. For sign language, certification may be required, or will be required, I'm sorry. For spoken language, Spanish is already available for certification. However, not every language is available. So slowly, it's going to progress to the point in which hospitals are requiring this for patients. As a spoken language interpreter, you must know that there are two kinds of certifications. One would be for CMI certification, which is Certified Medical Interpreter. The other one is for CHI, which is Certified Healthcare Interpreter. Both of those give national certification for an interpreter in the medical setting. So we want to make sure that if you have spoken language or if you have sign language interpretation skills, that you're providing a skill that is to the level that the hospital has required. A lot of hospitals are starting to redesign policies and redesign agreements with agencies to ensure that these qualifications are included in the language. So some of the challenges that you're going to encounter while you're interpreting in the medical setting. Every interpreter is going to find moments in which they are not sure what to do. They're not sure what the next step may be. If you're an interpreter in person, it seems that it's a little bit easier to give that information to somebody who's in front of you. However, if you're over the video, sometimes you may not have the access to give that information to the provider. It's hard to interrupt a provider by tapping them on the shoulder when you're on the other side of the camera. So some of those difficult situations that you may encounter is when you're unfamiliar with medical terminology being used. As interpreters in the medical setting, we could be in an OB clinic appointment, as well as we could be in a rheumatology appointment. We could be interpreting in the emergency room, as well as we could be interpreting in the operating room. Usually interpretation in the operating room is not very common. However, sometimes at the beginning of the surgery, an interpreter is required to be present. So with that said, an interpreter needs to be prepared to know that circumstances are going to come in which they're not aware of certain terminology being used. A lot of people who are interpreting VRI do have a computer access nearby that they can look into for certain terminology or assistance. However, if this becomes very common during an encounter, you may want to let the provider know and let them know that you are going to ask for them to call a different interpreter to provide that service. Remember, communication is one of the major sentinel events in the hospitals. And as interpreters, we want to make sure that the sentinel event is not because of our lack of knowledge in a certain area of the hospital or the care for that patient. Other times we may have difficulty understanding the patient or the provider. I know many times when I am interpreting, I may encounter a provider that is from a different country who has a very strong accent. Interpreting face-to-face, you can see expressions, and you can see the facial disposition that the provider is giving. However, if you're interpreting VRI, you shouldn't be looking at the provider, or the provider is doing something wrong. You should be looking at the patient. So it's going to be very hard to see those facial expressions for you to know exactly what it is that you need to communicate with that patient. Sometimes inappropriate lighting can be an issue. A lot of the providers' rooms in the clinical setting may have blinds or windows in the background. In other cases, in the emergency rooms, the light may be very dim. So this creates lots of difficulty for you as the interpreter, especially a sign language interpreter, to be able to read what the patient is signing and be able to give an accurate interpretation of what is being said. Make sure the provider understands this so that they can take proper measures. In the worst case scenario, they may change that patient to a different room. Cultural differences also create issues. Sometimes there are expressions that are learned from other countries that may not be the same in another country. I myself have had lots of issues as a Spanish speaker. Speaking in Colombian, which is my actual country, I use isms, or used to use isms from my country, and I had to slowly learn those isms from other countries. So as an interpreter, you want to make sure that you are a linguist, that you're providing the information that the patient needs, or the words that the patient needs to understand, knowing that in any language, or in any country that in my case speaks Spanish, that word will be understood. And then there's health literacy, probably one of the biggest issues for our patients. Health literacy many times is not obvious. And it's many times during the course of the interpretation that you would see that the patient truly is not understanding what is being said. The provider needs to work directly with the patient and understand what their level of understanding is. There are different ways of knowing that, and most of the providers will use words as, do you understand, and can you explain to me what you understood? If you think about it, you probably did it yourself, in which you were at the doctor, somebody said, do you understand? And you said yes. But really deep inside, maybe you didn't understand everything that the doctor was saying. So you want to make sure that this is not a situation such as yours. You want to make sure that this situation may be a little deeper, and make sure to cue the provider in so that they can work with the patient. Most of the work that they would do with the patient would be speak to them in easier terms or layman terms, so that they're speaking at the same level of comprehension as the patient. So encountering the situations that may be inappropriate while you're interpreting VRAI. As an interpreter, we may find situations that are not appropriate for using VRI. The interpreter is really the first one that will know that that situation is inappropriate. Sometimes the second one, but for the most part, the provider may not be aware that the situation is not the best for a VRI interpretation. Situations such as patients' cognitive, psychiatric, or linguistic difficulties. Many times, as the patient is receiving care, they may have medication and their mental status may change, which means that the interpretation is going to be different, and they're cognizant of the situation, and the interpretation is going to be different. Also, we have patients that may be lying on a stretcher or lying in a bed. It's very hard to interpret for a patient that you cannot fully see what they're saying, which means that the interpretation would not be appropriate. Some VRI machines do have a tilting mode. However, not all of them do have it, and it may be impossible for that patient to be seen appropriately so that the interpretation can take place. As I said earlier, sometimes when a patient is highly medicated, it may be very hard for them to even communicate. They may be slurring their words and may be speaking in ways that are not understandable to the interpreter, to the provider. It's important to let the provider know so that they understand the reasons why you're telling them that VR interpretation may not be the most appropriate for this particular patient. Also, there are certain patients that use regional signs or regional words. We want to make sure that they're using what is going to be understandable to the patient. We want to make sure that we're using something that will be appropriate and understandable to the provider as well. Even though the patient may be using a regionalism, sometimes we may not be understanding because most of their words may be regional and we may not be understanding it. Cases such as that may require an interpreter who's from that area. That will be able to understand everything that the patient is saying, or in some cases even the provider. As with every piece of equipment, just like your cell phone sometimes not working, just like your VCR sometimes not working, sometimes we need to hit the reset button and start all over again. And that may be the case in some of your VRI interpretation. Sometimes the machine is just not engaged into what it needs to do for that time, so they may need to reset the machine. In some cases, the patient will tell you that the image is blurry. In other cases, you may see the image blurry. Again, it's important to communicate that and let them know or guide them to use to follow the guidelines to fix that problem. As I said earlier, sometimes it's just a matter of turning the machine off and then on again, but in other situations it may require a lot more than that. And also, because we need to match specific interpreters with specific styles of interpretations of our patients, we want to make sure that if the patient is a CDI and may need an extra interpreter there, or maybe the patient has visual issues, not necessarily to use tactile interpreter, but that they are not seeing your image appropriately, they may need to call a different interpreter. Communicate this to your provider, the provider that you're working with. The patient will communicate a part of it. You need to complete the information so that they understand where they're coming from. The best service is going to be given when the patient and the provider understand everything that is being said during that encounter. I hope this information has been beneficial to you. Please remember that when you're interpreting via VRI, there are a lot of things that may happen. Communicate that to the patient. Communicate that to the provider. Let them know if there's an issue. Let them know if it's working well. Let them know what's best for this patient. Because many times VRI is magnificent for it. Other time is not the solution for it. Also remember that many of the hospitals that are using VRI are in rural areas where getting a sign language interpreter may be very difficult and may take many, many hours. In many cases, you, the VRI interpreter, will be the person that is working with them in the interim until that interpreter arrives. So know that, keep all the information with you, and keep VRIing because we need you and we know our patients need us as well. Thank you very much. I hope this information has been helpful.